Hey guys, it's Christina and this is my channel where I teach you to be the CEO of your nursing license. So today we're going to talk about benefits. So many people ask me about doing a video about benefits, and that makes complete sense because I was super nervous to be a travel nurse because I was worried about health insurance. And my husband has always been on my health insurance just because usually when you work in a hospital, it's better. So yeah, let's get into it because I know you guys have lots of questions. So I'm gonna go over all the benefits that I get as a travel nurse. Now, every travel agency is going to be a little bit different. I work for Aya, and I feel like Aya is a very popular one that a lot of travel nurses work with. The great thing about travel nursing is hospitals can no longer lie to you and be like, you know, we're gonna pay you shit because we give you benefits. Yeah, that's not the case because travel agencies are now giving just as good benefits, if not better. A lot of hospitals, I know for example, when I worked in Miami, Florida, when COVID hit, they took away our 401k. Legit, like that week we got an email saying that they would no longer be matching because of, you know, COVID and the money they were hemorrhaging, even though we all know hospitals made millions of dollars during the pandemic still, regardless. So I have no idea. I'd have to text one of my old coworkers and find out if they ever got their 401k back, but that's ridiculous because a 401k is a huge, huge benefit. So let's start with that one. So Aya gives you 401k benefits after you've been working with them for 90 days. So basically after you've done at least one assignment, and you have to stay with Aya to get this benefit. That's another benefit of not jumping around to different travel agencies is the 401k. So with Aya, after 90 days, you can start contributing yourself to your 401k, and after 1 year, they will match. So what I do really like about their 401k is they use index target date funds, and not all 401ks do that. And so they have a really good one in my opinion. After 90 days, you can start contributing. And then after a year, what their matching program is the first 3%, they give you a 100% match, and then 50% match for 2%. So you're essentially getting like 4% from them, which is pretty good in comparison to other hospitals. When I was a staff nurse, when I worked in Tampa, they had a really good one. It was like 10%. They matched 100% the first 5 and then half the last 5. When I was in Miami, it was about the same as what Aya was. It was a full 3% match and then half at the last 2. So I feel like it's a pretty good standard match that most hospitals do as well. They use Empower Retirement, which I've never used before. I feel like most hospitals use like Fidelity or something like that. But what I do like about the Empower Retirement website is it's like really easy to use, and they like make it very user-friendly, way more user-friendly than like Fidelity or Vanguard. So I like it, and I feel like it's a pretty standard match. It's comparable to what hospitals would give you. Okay, let's talk about sick time. Yes, you do get sick time as a travel nurse. So I am logging on to my statement right now, and it looks like every week I accrue 1.4 hours. And you know what? Let me go back real quick because I want to compare that to my first paycheck. Okay, so my first paycheck with them, I accrued 1.06, and now I'm accruing 1.4. So I don't know for sure, but my guess is the longer you with them, the more you accrue. I've been with them for almost a year now. So my first assignment was about 1 hour a paycheck, and now it's almost up to 1.5 a paycheck. I currently have a sick balance of over 40 hours, and I usually work 10-hour shifts, so that's 4 sick days. Now, how sick days work with Aya is you'll get paid your hourly rate if you call out sick, but you do lose your stipend for the day. So it's not always beneficial to call out sick because that stipend is huge. However, if you're sick, obviously you're sick and you need to take the day off. But it is nice that you will get paid your hourly rate and they will cover you for that. So it is a nice little perk that they do give you sick time. You don't get vacation time, and that makes sense because you can take as much vacation as you want in between assignments. That's the fun part about being a travel nurse. Now let's talk about how much vacation time on your own. It's unpaid vacation time basically. When you are not working, you're not getting paid. Now, to keep your healthcare benefits with Aya, you can take 23 days off in between assignments, which is about, a little over 3 weeks. So I think that's pretty good. It's not bad. Obviously, if you are one of those people that wants to take, 2 or 3 months off in between assignments, you will have to cover yourself for healthcare. All right, so let's talk about healthcare benefits. I know that is a big topic that so many of you wanted to know about. So Aya uses Aetna, which I personally like Aetna a lot. I've used them before as a staff nurse, and I feel like a lot of places, a lot of doctor's offices cover Aetna. It's a pretty popular one. I feel like they have pretty good coverage. Okay, so here's how it works. If you are just getting health insurance for yourself, Aya is gonna tell you it's free. It's free, but it's not. So I went back to my first paycheck as well because my husband was not on my health insurance. So if you look at your paychecks with Aya, because you'll get paid weekly and you're able to log in and look at them, there's nothing charging you for health insurance. But if you have a good recruiter who's upfront with you, they'll explain the process to you. If you go on the Aya website, you will see a range. It'll be like, okay, this pay package is anywhere from $3,900 to $4,100. If you're getting health insurance with them, they're actually taking about $120-ish from your stipend. They can't take it legally from your hourly rate. That's how my recruiter explained it to me. So let's say you are in a city, we'll just say Atlanta, for example. You're in Atlanta, let's say your weekly stipend is $1,400. You will probably get like a $1,280 stipend because they're going to take $120 from you every week to cover that health insurance. So it won't show on your paycheck being charged for health insurance, and you will be covered, but they're just taking it from the stipend. So that's why there's like a range of what you're making. And then if you're not taking health insurance from them, then you would get the full stipend. So you get like $1,400. So I don't know if I love it or hate it. Like, it is what it is. I guess it's nice that they just take it from the stipend and then you don't have to worry about it and you get full coverage. You do get dental and vision if you choose to do that, as well as standard medical health insurance. You can upgrade your health insurance to a more premium package if you want to, and then you will get an extra charge on your paycheck. So they'll take the $120 a week out of your stipend, and then they'll charge you for the premium one. I can't remember the exact amount of how much they will charge you, but you will get a charge for that as well if you upgrade to premium. Okay, so let's talk about spouse, because my husband, he was able to join my health insurance like halfway through when I started doing things. So he is now on my health insurance. So I'm able to pull up my paycheck, and so I can tell you exactly how much they charge me now. So now I have pre-tax deductions and I have a PPO where they take out $138.88 every week, and that covers me and my husband. And then they take out dental and vision, which obviously you don't have to get dental and vision if you don't want to, but it's really cheap. I pay $6.52 a week for it. In my opinion, it's worth it. I don't have contacts or glasses, but my husband did LASIK surgery and he really liked it. I know that that was covered. That was our old insurance, but it's good for us to have vision because, you know, in case something happens for him. And then dental is always good to get your teeth cleanings, or if you have a cavity, like, it's cheap enough that I would do it. So I'm gonna go on the Aetna website so I can tell you exactly what my deductible is. I have the standard one. And now if you add kids to yours, there's probably going to be more charges. So it's me and my husband on my health insurance, and that's how much I pay. And remember, you're paying weekly. And another thing is, when you're not working those 23 days in between, you don't have to pay for your health insurance. It's not like they charge you that $138 when you're not working. It covers you that whole month. So basically the $138 you have to pay weekly. So you're paying about $500 out of pocket every month for me and my husband. I'm on the Aetna website. I actually really like their website. It is very user friendly. So my deductible for medical coverage is $2,000. And then there's a button that says what's covered. So basically all my doctor's appointments, deductibles are waived, and you have a $15 copay. That's for specialty office visits, outpatient like mental health visits, and any primary care visit related to any doctor treating like an illness or injury. That's just like basically your yearly exams. So all of those are waived. Your deductible is waived for those, but you do pay $15 copays. For outpatient testing, also a $15 copay, but the deductible does apply to this service. Your plan will pay 100% after the deductible is met for any labs, x-rays, imaging, anything like that that you would need. Now there's routine services on here that you do not need to pay anything for that are completely waived. There's no deductible needed and there's no copay, and that goes for routine exams. So routine eye exams, routine mammograms, a colon cancer screening, a physical exam, immunizations, a prostate cancer screening, and then a well woman exam visit. It says that your plan will pay 100% for 1 pap smear a year and 1 gynecology exam a year. For women, any maternity and pregnancy things are also completely covered, such as, let's see, breast pump and supplies, lactation consultations, and preventative prenatal care. Okay, so then for hospital stays, so like if you had to go to the emergency room, your deductible will apply to that. So this one also is talking about surgery. It just says same day surgery. You know, that could be a million different things. Your deductible will count towards that. And same thing for any infusions. That's pretty cool that they wrote that on there. I've actually never seen that written anywhere before. That's why I really like Aetna. They break everything down for you, but they talk about infusion therapy. So anybody who needs infusions, your deductible is actually waived for those, and all you have to do is pay a $15 copay. So that's pretty amazing for anybody out there who maybe like gets infusions regularly, like if you have Crohn's disease or arthritis or you need something. That's pretty cool. And then there is a walk-in clinic on here, and that one your deductible is waived and you just pay a $15 copay. So that's great for those people out there who just like to go to like Walgreens, CVS, and you know, see a nurse practitioner. So I think that the coverage is pretty good. I think it's pretty standard. Obviously, if you go to the emergency room, your deductible is going to count towards that. That's basically anywhere, but they have a lot of stuff like preventative exams that are completely free where you don't even have to pay a copay. So I think that's great. And then I think $15 is reasonable if you're just gonna go, you know, see a primary care physician, or you could just go the CVS Walgreens route and not pay anything if you don't have like a primary care doctor. So that's basically how it's broken up on the website. So that's a basic rundown. And then I'll give you a real quick rundown of my dental coverage. So my annual benefit for my dental coverage, that's the one where I pay just a couple dollars a week. I get a $2,000 plan, and I've already used $100. I'm like nowhere near hitting that. My plan covers $2,000 and I've only used $170 this year, and that was because I went and got like a dental cleaning. So to me, I guess you could figure out how much often you go to the dentist, because I mean, if I pay $3 a week for that and $3 for vision, I guess I could have paid out of pocket for that cleaning, but I don't know. It's cheap. I don't mind paying it, but yeah, so you're covered for $2,000 for dental. So if you're someone who knows that you want to get some work done, you could even see if like, actually, hold on. Let me see what's covered. So for coverage, it doesn't go into a whole lot of details. It just says basic, major, and preventative services are covered, like up to $2,000. So if there's some work you wanted to get done, or you know you might need like cavities taken care of or root canal, you have up to $2,000, and I feel like that covers a lot. And then there is pharmacy coverage on here. So if you are on any medications, I mean, there's just so many meds, I wouldn't even be able to tell you exactly how much those would be, but you do get pharmacy benefits. That one doesn't go into too many details, probably because there's so many drugs out there that people are on and taking, but I would assume that you would be covered for a lot of them, or pharmacy can always work with you to find like a specific one that's like, you know, maybe a generic version that your insurance covers. Okay, I hope that was helpful. I really tried to tell you everything I could think of, but as always, leave a comment or a question. I'm always responding to you guys. If there's anything specific you want to know that I did not mention in this video, leave a comment and I will get back to you. If you enjoyed this video, give it a thumbs up. Don't forget to subscribe, and I'll leave another video right here so you can go check out that one next. Bye guys.